The final segment here is to try to give you a sense of the voice of the public and of health professionals about these professions you've been hearing a lot about. And there's really a long tradition of public polling about the role of health professionals. Some of this work is really where I began, and it's close to my heart to think about how does the public see these professionals, even when they're reading in the news about, all of these other issues of, supply shortages, problems with care coordination, health IT. They may hear all of these issues, but really, what do they think about professionals and the relationships they have with them? So the first thing I want to show you, this is from a study that we did a few years ago, but the data really haven't changed very much. We're looking at the public's perception of different careers in the U.S., sort of how positively you view people in these professions. And one of the things that my nurse colleagues are always very excited about is in most of these public polls about honesty and integrity of professions or, trusted professions, nurses always edge in there slightly ahead of the physician. Basically they're about the same. Here you see public school teachers really up there, a little bit ahead of both. You then really see, I think, a sort of drop off. I have a couple of other health professions in here, scientists, pharmacists. We actually put police and fire and clergy and attorneys and athletes and members of the military into this scale. I think what we want to reflect here is that these are perceptions of this career. And so I wouldn't read, for example, the military line here as people who don't like military, people in the military. I think it's more like, would that career be good for me? But, you see inevitably people view these kinds of jobs, especially riskier jobs, a little differently. But in most of these kinds of measures, health professionals are always kind of at the top. And that's despite some declining trust in all professions over the last few decades. So how do they think about the pay for these folks? Given what you know about healthcare, how likely would you be to advise a qualified high school or college student to pursue these careers? These data will show you the physician perception of nursing and medical careers, the nurse's perception of nursing and medical careers, and the public's perception. And the main point that I want to make here is this is actually an area where nurses and doctors agree quite a bit. They agree that these are good careers to be in. They may not all say, oh, you should definitely do this. There's a large number in the probably. But if you add up the positives and the negatives here, by and large, nurses, doctors, and the public agree these are great careers. The public is more positive about these careers than the professionals are themselves. So finally, how do professionals feel about their jobs? We've heard all of these stories now of all the stresses and strains on the health professional of today. And we look at their current employment and their career perception. And again, back to the primary care physician and nurse practitioner, you really see that, the vast majority of these people are very happy both with their jobs and with their careers. Despite the stresses and strains, these are perceived as good jobs to have. These folks are trusted by the public to provide them needed care. And those relationships are really primary to people. If you go and you're trying to get care from our healthcare system, the primary relationships you're likely to form are with these health professionals. It's why these topics matter a lot. The politics are interesting, but at the end of the day, I think we need to focus on when people need help, where do they turn? Do we have enough of those people to welcome them, meet their healthcare needs, organize their care, and help them get healthy again? And as we seek out new policies to do that in a more efficient or effective way, these players in the health profession become very important pieces of the conversation. they will keep themselves in the conversation, and politicians at the state or federal level know that they have to listen. Okay, so we've covered a lot of ground today, so I want to do a quick summary of key issues across the whole presentation, so you have some issues to take forward as you think more about the health workforce. The first is that national and state health policy are critical here, and right now they're challenged by both a lack of data and professional disagreements, which I think are enhanced by a lack of data. It's easier for people to disagree when they don't have the right information or common information. Having that workforce commission not be functional, I think, has really hurt trying to get a better handle on what's happening with all of these health professionals. I know that it's particularly hurt in the nurse practitioner context. We have much better data on physicians than we have on nurses in this country. Secondly, I want you to remember that this is a large and complicated workforce. The more technology and innovation drive us towards specialization, the more complex that workforce is going to get. Even as we look for more specialization and we make this workforce more complex, we have real-time primary care shortages. And those primary care doctors and nurses are supposed to be the people who are helping to coordinate all that specialization. Those primary care providers are right at the nexus of increasing patient demand in our system and this increasing specialization and increasingly complex system that they're supposed to be helping people navigate. So how we're going to help them, either with human tools or technology tools to improve care coordination, requires innovation. A lot of people talk about innovation. Real innovation is in desperate supply, I think, in our system. Along the way, while we're having our professional disagreements, we have to think about how disruptive or bad behavior on the part of some rare professionals can be regulated in order to earn and keep that public trust. We know that public trusts these professionals personally and, and sort of in the aggregate as professions, but we also know there's been some erosion over time. So we need to think about how we can manage these professional disagreements in a way that doesn't erode the public's perception. Part of that is being imaginative, thinking about teams, thinking about the role of people in those teams, trying to get more efficient about that so we really learn who needs to do what, who needs to be trained and educated for what type of role, and can we educate people to work in teams together. And I think that's the point that I would like to end on here, is that right now, nurses go to nursing school and physicians go to medical school. We're not really training people for collaborative practice. We wait until they've formed their professional codes and they've gotten their professional training, and then we put them into healthcare settings where they're supposed to work out those differences in culture and training. The more that we can educate people for this future, the more we can start to solve these care coordination issues, overcome the professional conflicts, and start to understand what our future workforce needs look like. So as we take into account all of the issues I've talked about today, we'd like to really focus on how we can be more innovative in education and training for collaborative practice to really enhance the futures of all of our healthcare professionals. Thank you for your attention.